Coronavirus Q&A, getting answers to your most pressing questions during an uncertain time. Welcome back to the KSAT News at 9. That's the goal of this news section, dedicated to talking to experts about things you need to know about. Tonight, we're joined by Debra Serna, the Senior Laboratory Manager from University Health Systems, to talk about the need for blood and how we can all help out when it comes to blood donations. Debra, thank you for joining us again tonight. Talk about the need and just how pressing is it?
So the need is pretty great because we've had a drop in donations. We don't have the supply we normally do. And so it's really, really needed right now that we get blood.
A lot of the blood mobiles that people had scheduled and a lot of the special events had to be canceled because of coronavirus, correct?
Yes, correct. We've had a lot of our blood drives cancel. And so that is a big dent in our blood supply.
All right, let's get to some of our viewer questions that we have tonight. Can mosquitoes transmit the coronavirus? Can COVID-19 spread through blood? That's actually one of the questions we got from viewers.
As far as we know, the coronavirus does not spread through blood. We haven't had any cases. They're still doing studies, and there's a lot we don't know about the virus. But for now, we know that it's not transmissible through blood.
It is safe to donate.
Correct. Yes, very safe.
Can you give blood if you have diabetes? Diabetes, obviously one of the big health concerns in San Antonio and South Texas.
So for most diabetics, are not on insulin. It's usually okay to donate if you have an oral medication that you're taking. If you're a regular donor, you've been donating for years, it's not an issue. You can still donate. Okay,
so I think what you said is if you're not on insulin, you should be able to donate based on your medications, correct?
Yes.
Yeah.
Yes, correct.
You're breaking up on us a little bit with the Skype signal, but
sorry.
That's okay. What precautions do you at UHS use before people give blood? I mean, when I walk in to give blood, let's say tomorrow at the blood drive that KSAT 12 is having, will you take my temperature? What kind of precautions will you take?
Definitely. We usually take your temperature as part of the normal screening process for blood donation, but this time we're taking it the first thing as soon as you walk up to the donor area. And that's just so that way we can verify that your temperature is good before you enter the rest of the donation area with the rest of the donors. Also with our staff, we want to make sure that they're protected as well. And so we will take your temperature at first. We will ask some screening questions too. If you've been out of the country, where have you traveled in the last 28 days? And again, that's just that order.
If you're anemic, can you give blood?
So if you're anemic, unfortunately you can't, and that's something that was before even coronavirus. So if your iron or hemoglobin level is below a certain amount, then you don't have enough blood to give. And so there's certain ways that you can help. Some people have low iron, or some people can eat certain foods or take certain vitamins to help increase that.
Is there any kind of blood type that you're looking for that's more important than others? Like I think O negative is the universal donor, but is there any certain type of blood that you're looking for more so than others?
We're looking for all types this time. Sometimes we have a need for the universal donor more than others, but this time we need all types. So we are definitely taking everyone that's willing to donate.
Have you ever experienced anything like this? You said earlier that you'd been at University Health Systems for 10 years. Have you ever experienced anything like this that's affected the blood supply this much?
Not like this, for sure, because it is not only a statewide issue, and so because of that, it is something that I've never seen before there.
All right, but the need is great, and again, you can donate University Health System anytime. We're having a blood drive tomorrow, but we're very happy to report that blood drive is full, but there are other locations that you can donate. DonateBloodToday.com, is that the website that we were talking about earlier?
Yes.
Yeah.
Yes, correct. You can go there to schedule your appointment. That's part of one of the measures that we're taking to, reduce crowding. And so definitely make an appointment there to come visit us after the blood drive.
All right. Debra Serna with the University Health Systems. Thank you very much for joining us. It's been a pleasure. Again, we are trying to separate.
Thank you so much.
Thank you, Debra. Trying to separate the fact from the fear in some of these questions, and we will continue to do this program every night as long as this crisis continues. We'll be right back.